Hello everyone and welcome to Blood and Hematology YouTube channel. This video is about morphology of fragmented erythrocytes. Schistocytes are damaged or fragmented red blood cells, which are formed either following mechanical, toxin or heat-induced damage of previously normal erythrocytes, or by fragmentation of abnormal red cells. Schistocytes are always smaller than intact red cells and can have the shape of fragments with sharp angles and straight borders, small crescents, helmet cells, keratocytes and microspherocytes. In healthy adult subjects, schistocytes do not exceed 0.2% of red cells, but in neonates they may be up to 1.9% and in premature neonates up to 5.5%. The common conditions associated with schistocytes are listed in the table. Irregularly contracted cells are small hyperchromic erythrocytes, lacking an area of central pallor, which are distinguished from spherocytes by their irregular shape. They show both a staining anomaly and an abnormal cell outline. Sometimes there are also small protrusions that can be shown to represent Heinz bodies. The distinction between irregularly contracted cells and spherocytes is important, since the diagnostic significance is different. Irregularly contracted cells are associated with hemolytic crises in glucose 6-phosphate dehydrogenase deficiency, oxidant-induced hemolysis, exposure to oxidant drugs and chemicals, and some hemoglobinopathies. Blister cells are a variant of irregularly contracted cell, with abnormal distribution of hemoglobin, leaving empty a smaller part of the cytoplasm as a clear zone. Blister cells are the precursors of keratocytes or bite cells. Blister cells are associated with hemolytic crises in glucose 6-phosphate dehydrogenase deficiency or oxidant exposure, and sometimes in sickle cell anemia. Keratocytes are erythrocytes with pairs of spicules, usually 2 but sometimes 4 or 6. They are formed when there is mechanical damage to red cells, such as fibrin strands or a malfunctioning cardiac prosthesis. Keratocytes can also result from removal of a Heinz body from erythrocyte. Keratocytes are associated with schistocytic hemolytic anemias, disseminated intravascular coagulation, renal disease, uremia, and renal transplantation. Ghost cells are erythrocytes that have completely lost their hemoglobin during acute hemolysis in glucose 6-phosphate dehydrogenase deficiency. Microspherocytes are a morphological variant of a schistocyte, formed by mechanical damage and are particularly common after splenectomy. They can represent remodeled schistocytes. Microspherocytes are associated with microangiopathic and mechanical hemolytic anemia, extensive burns, severe anemia with dysmorphic and ineffective erythropoiesis. Thank you for watching this video. If you liked this video, to give it a thumbs up and share it. Do not forget to subscribe to the channel, if you still have not. You can click on the bell to receive notifications whenever a new video is uploaded.